I mean, cardiovascular disease being the number one killer for I don't know how many decades. If we could have genetic testing affect the outcomes in terms of individuals that particularly the ones that die from sudden heart attacks. And oftentimes we hear about seemingly healthy individuals that succumb to that, and then we see what we intellectually refer to as train wrecks in terms of individuals that are 600-700 pounds and walking around living for decades. So is there a genetic predisposition there in terms of why one succumbs to cardiovascular disease so easily and the other one doesn't? Diabetes, I manage a network of practices in the Bronx. Many of our patient population suffers from diabetes, probably the most prevalent condition in our patient population. And there definitely is a significant genetic predisposition to that illness. So genetic testing and then genomic testing. There's so many different diabetes medications on the market. If genomic testing could guide the provider as to which ones would be more effective, I think that would be a tremendous breakthrough in healthcare. So my wish list, outside of oncology, would be cardiovascular disease and diabetes. And I think I think we're nearing a point where we can see the effect of that, but we need more time and more research. That would be my wish list. In our practices, we also service a large number of individuals that are suffering from addiction. So there's been a lot of studies that have shown that there is a genetic predisposition to becoming addicted to certain substances in certain individuals. And one case that stands out was a lady who had a dental procedure. And because of the amount of work that she had performed on her, the dentist prescribed an opiate pain medication. And then she began to take it, and within about a year or so, she found herself addicted to prescription drugs. And I remember speaking with her, and she was in tears because she said, I didn't ask for this. I went to just have a simple extraction, and I don't know what happened. So in that situation, she likely did have a genetic predisposition to becoming addicted, because there are folks that, can take, pain medication for a short period of time and it has no effect on them. But there's some other individuals that they take it one time or two times and then it does something to their body and to their chemical pathways. So I think if we could display a genetic predisposition to addiction through genetic testing and then tailor our pain prescribing habits away from that in certain individuals, I think that would have a tremendous effect also.